Hospital systems being targeted by cyber hackers at an alarming rate with the goal of stealing millions of patients' sensitive records.
Patients at Corewell Health have received letters like this one after 2 separate cyber attacks last month.
7 Action News reporter Simon Shaquette is digging into why the troubling trend is worsening and how to avoid becoming a victim.
From right here in Metro Detroit to other parts of the country, a rise in cyber hacking targeting hospitals has led to growing concerns for patients.
As we're going more the way of cyber and everything is going out onto the net, the web and everything, it doesn't surprise me, Simon.
For Detroiter Herb Hayden, the threat of a cyber attack comes with a potential for great harm that can turn into a real-life nightmare. A family member of his recently had their identity stolen, which compromised their sensitive personal info.
Someone has stolen your identity, then the onus is on you to prove that it wasn't you.
Just last year, we saw a staggering number of cyber attacks targeting hospital systems across the country and right here in Metro Detroit.
Thousands of patients, and those patient files will contain their address, date of birth, social security number, all the pertinent information that hackers could use to exploit for illicit purposes.
Retired FBI supervisor Andy Bartnowak is talking about the attack that led to more than 1 million Corewell Health patients being informed by mail that their info had been compromised in another cyber attack. In this case, a third-party vendor suffering a data breach, exposing social security numbers, names, billing info, and more. What can hospitals do to protect their patients in a better way? He says better training for staff on what to watch out for when it comes to phishing schemes, along with more security and improved policy, are crucial.
Either it's an IT issue where policy wasn't followed properly, or it's human error.
In total, 2 cyber attacks on Corewell Health took place in December alone. Other Michigan hospitals were also targeted in late 2023. And outside Michigan, hackers forcing a Tennessee-based hospital to shut down emergency rooms as patient records were held for ransom. Are you surprised at the rate this continues to happen?
I think it's very troubling. If you've got to shut down any emergency room, no matter what the size, you're basically putting patients' lives at risk because you can't treat them.
Citing the cybersecurity research institution Ponemon Institute, the 2023 healthcare report showing roughly 88% of healthcare companies experienced at least one cyber attack in the last year, costing millions on average. Bartnowak says hackers can bank on hospitals paying a ransom, and what they're stealing is becoming more valuable on the dark web.
Before you open up that email, if it doesn't look right, the heading doesn't look right, click on the email itself, the address, and if that address is not the actual address to that company, then you know it's a bad email and don't even open it up.
He says the more hospitals pay, the more ransomware groups become emboldened, which is why people must have credit monitoring and identity protection set up before becoming a patient. In part of a statement, a spokesperson for Corewell Health telling us, quote, "The privacy of our patients is a top priority. Like most healthcare organizations, we work with vendors who offer specialized services or expertise. Both of our vendors that were affected last year, Health EC LLC and Welltalk Inc., conducted thorough reviews to determine who was impacted and what data might have been accessed. Both vendors alerted our team."
How confident are you when you go to a hospital as a patient that your information is going to be secure?
That confidence level would be down because not only now are they getting my financial information, they're also getting whatever confidential health information that I have.
Credit card monitoring and identity restoration are among the services being provided. However, hospitals are urging patients not to wait. From Royal Oak, Simon Shaquette, 7 Action News.